The lateral sacral crest is the continuation of the transverse processes as they come down. The SIJ is made up of two bones, the ilium, which is part of the innominate, or the hip bone, and the sacrum. The innominate is actually a fusion of the ilium, the pubis, and then the ischium right here. We have the lateral aspect of the ilium here, and you can see the iliac crest, iliac tubercle, the anterior superior iliac spine, and the posterior superior iliac spine, the medial aspect of the ilium. You can see here the auricular structure. It's called so for its ear-like shape. It has either like a C or an L shape. On this ilium, it's actually made up of fibrocartilage versus the sacrum being hyaline cartilage. You can see sort of the shape. So even on this three-dimensional model, I don't think you would normally have these blue spikes coming out, these rods coming out, unless maybe you had a lateral SI fusion. Nonetheless, on this small portion of the ilium, you can see this auricular sort of articular surface on the ilium here too. All right, the other aspect of the SIJ, the sacrum. This is the anterior view or the front view. Some notable features are the promontory right here and the anterior foramen right here, the anterior sacral foramen right here. You can actually even see these on this three-dimensional model right here, and then the promontory you can see more on a lateral view here too. The lateral aspect of the sacrum, you can see its auricular structure right here, this L-shaped or maybe C-shaped lined with hyaline cartilage. And you can see it also on this three-dimensional model. You'll notice that its length is basically around the same length as S1, S2, and S3. And I think what I would take away from looking at this so far is just how strange this joint is, the shape of it. That is good to have in mind when you're looking at fluoroscopic photos, because you're not going to just see a normal hypolucency that would just be some sort of line. It's going to be sort of challenging to see exactly where you are, whether it's this interior portion of the joint or the posterior portion of the joint. We have the posterior aspect of the sacrum. So the sacrum is a fusion of 5 vertebrae. And as we age, these fuse. And typically in our late 20s, these are completely fused. Not everyone's, but most of us. And you can see these bony prominences right here. You can also see them on the three-dimensional model right here. These bony prominences are essentially a continuation of the spinous processes you can feel in your lower back, if you're lumbar, you're thoracic vertebrae. And then you have the lateral sacral crest. So this is the median sacral crest. The lateral sacral crest is the continuation of the transverse processes as they come down from the lumbar spine into the sacrum. Then you have the posterior foramen, which is where the posterior dorsal rami of the spinal nerves branch off to. You can see all those elements right here. So the median sacral crest, lateral sacral crest, the posterior foramen on either side as well. And then just again, look at this strange structure you have on the sort of lateral aspects that articulate with the ilia on both sides. Lastly, you can see this sacral hiatus at the very bottom. So this is the area in which we do a caudal injection, and that's just a side note. And you kind of have landmarks to do that with these sacral cornua. The sacroiliac joint is really important as it basically transmits forces from our upper body, so up here, to our lower body, through our hips into our legs, so through the femurs right here. And you can see just how everything is so interconnected. It's so special that it has its own name for the way in which it moves. It's called nutation and counternutation, I think in reference, or that means essentially nodding. So you can see how you can almost see the sacrum nodding forward. So this anterior-inferior movement of the sacral promontory, and then this posterior movement of the coccyx. Counternutation is essentially the exact opposite of that. So this posterior movement with the anterior movement of the coccyx right there. This affects the shape of the ilia as they move back and forth, and even the shape of the symphysis pubis right here too. At any rate, I'm not going to get too stuck on the biomechanics of the sacroiliac joint. That really requires a very, very good PT or kinesiologist or a chiropractor. So this is about a SIJ injection, and so we'll go ahead and just move forward. I think there's around 2 to 4 degrees of this nutation, counter nutation, but I think we'll just move on from now. Jump into the ligaments of the SIJ. We're not going to talk about all the ligaments of the hips. There are a lot, but starting off, we'll have the anterior sacroiliac ligament. It essentially comes from around like the third segment of the sacrum, laterally, both sides to end in front of the joint or around the auricular surface of the ilia. Then posteriorly, we have the posterior sacroiliac ligament, which is composed of 2 ligaments, the short and the long. The short is from the first and second transverse tubercles of the sacrum, and it attaches to the tuberosity of the ilia. And then you have the long sacroiliac ligament, which comes from the third and fourth transverse tubercles of the sacrum, stretching to the PSIS, so the posterior superior iliac spine. The sacrotuberous ligament. So you have the ischial tuberosity right here, attaching to the sacrum from around the fourth, fifth transverse tubercles of the sacrum, and also part of the coccyx right here too. The ischial spine attaching to the sacrum, aptly named sacrospinous ligament. It attaches from this lower aspect of the sacrum and the superior aspect of the coccyx down to the ischial spine right here. And it's worth noting these 2 sacrotuberous and sacrospinous ligaments essentially make up our greater sciatic and lesser sciatic foramen. Not that this talks about a caudal injection, but I thought it'd be worth mentioning the posterior, superficial, and deep sacrococcygeal ligaments just because they're involved with caudal injections, and we're in this space already. Something else worth mentioning would be the innervation of the SI joint. Depending on where you read or who you talk to, you might see different things for the innervation of the joint or the ligamentous structures, like the dorsal rami of S1, S2, sort of the spinal nerves coming through this sacral canal and then coming out these posterior foramen innervating the joint, the ventral rami of L4, L5, the superior gluteal nerve or the obturator nerve.